Lift every voice and sing till earth and heaven rings. Ring with the harmony of liberty. We approach your throne today, merciful God, because that is who you are. You are the great I am the way, Heavenly Father, and we want to thank you on this day because this is truly the day that you have made and we shall rejoice and be glad in it. Thank you for a celebration of history. Thank you for those who have came before us, mothers, fathers, sisters, brothers. Thank you for the remembrance how kings and queens came across the water, and even through tragedy, through suffering, look how far we've came. Thank you, God, because the songwriter said we've come this far by faith, leaning on you. So we want to celebrate you today. We want to celebrate those who have taken this journey and who continues to walk in your name. You are wonderful Counselor, mighty God, the everlasting Father, the Prince of Peace. And because we know that your eye continually is on the sparrow, that you continually watch over us. So even as we celebrate today, because you said that you inhabit the praise of your people, know that we celebrate you and all that you have done for us and that you continue to do for us, that you have never left us, neither will you forsake us. So we are going to sing a song full of the hope that the presence has brought us. We love you because of all that you have taught us, and we thank you on this day. And we praise you and we bless you. And it's in Jesus' name. Amen.
Good afternoon and welcome to Neptune Township's Black History Month celebration. My name is Mayor Nick Williams, and it is my honor to be part of such a wonderful day, but also the opportunity to speak about the COVID virus that has ravaged our communities, shut down so many aspects of our economy, and more importantly, took way too many lives. As we celebrate Black History Month and keeping with the theme of today's events, we thank Diana Harris and the committee for once again organizing it. But we must also note that we are again virtual and not together in the pack like our former years of celebrations. Sitting here and recording this, it also appears that the wave of COVID, led by the Omicron variant, is starting to subside. While the spread was rampant and the numbers of death were less, we will continue to fight until it's over here in Neptune Township. Locally, we have worked hard to encourage all residents to get vaccinated and hope all will stay protected through additional boosters. We understand that within some parts of our community, there are both historical and cultural barriers to achieve maximum vaccine rates, and we continue to work hard to overcome that. We have provided a tremendous amount of both testing centers and the availability to receive both the vaccinations and booster shots. And for this, we thank all our community partners for their support. Going forward, in addition to continuing our battle against COVID, we must find ways to ensure that when it comes to healthcare access and delivery, equality is our goal. No Neptune resident, man, woman, or child, black, brown, or white, affluent or financially distressed, Christian, Jewish, Muslim, or anything else, a part of the LGBTQ community or not, should ever have to worry about their health should illness or injury occur to them or their families. As Mayor of Neptune Township, you've got my commitment to help make this a goal that I will fight for on all levels of our government. Thank you, and may God bless each and every one of you.
Welcome to the 2022 Annual Black History Celebration. My name is Dr. Tammy Crader, and I am the Superintendent of Neptune Township Schools, a community for all learners where we value opportunity, diversity, and accountability. This year's theme of history, health, and sanity during COVID-19 resonates with our students, staff, and families, I'm sure. For the last 2 years, all of our students have learned remotely, have learned with some students in school and some students at home, have been masked in our schools, have socially distanced in our schools, and some of our youngest students know no other way of school. It is especially important that we take the time now to hear from our students, staff, and families about their experiences. Designing this celebration to encourage community members to pause and reflect brings us together through shared experiences, as well as through learning about the many different experiences our community members have had. I want to thank the members of the committee who have worked so hard to plan this special event. We are grateful as a school community for being asked each year to contribute. I also want to thank those members of our school community who did contribute. I know you will enjoy this event despite its being virtual for the second year. Again, welcome to the event and thank you for attending.
Welcome. We are the 5th grade safety patrol of Shark River Hills Elementary School. Please stand for the pledge of allegiance. Ready? Salute. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
History, health, and sanity in the midst of COVID-19. This is the year 2022. What are we going to do? Will things remain the same? Playing nonsensical political games. Take time to spread love and have some fun. Show respect and care for everyone. Stop vaccination lies and misinformation. These mistruths create unhealthy situations. Find your joy wherever you can. Seek justice and fairness for each and every man. Check on your friends, even if they seem strong. Are they okay? Or is there something wrong? Engage in conversation, or simply just ask. It's hard to tell expressions when you're wearing a mask. Our history shows times of survival, strength, and endurance. Positive mental and physical health practices should be an everyday occurrence. Do something that can bring you happiness, at least for a little while. Laughter is a great medicine that brings a needed smile. Remember to always celebrate Black history. Continue to strive for good health and peace and sanity. Peace and love.
You're broken down and tired of living life on a merry-go-round, and you can find them higher. But I see you, so we can walk it out and mountains. We will walk it out.
Chappelle is an African-American scientist and inventor who worked for NASA for several decades. He received 14 U.S. patents for inventions related to medicine, food science, and biochemistry. He devised ways for scientists to measure plant health and detect bacteria in outer space. He is a member of the National Inventors Hall of Fame and is known as one of the most distinguished African-American scientists and engineers of the 20th century.
I'm Colleen Corcoran. Kismekia S. Corbett is a professor of immunology and infectious diseases at Harvard Chan School and was named one of 4 Heroes of the Year for conducting groundbreaking research in developing a Moderna COVID-19 vaccine. Kismekia Corbett is just getting started. She is now researching pathogens that may spark the next pandemic.
Hello, I'm Aubrey Richardson. Dr. Marilyn Hughes Gaston made history in 1986 by publishing a groundbreaking study on sickle cell disease that led to a nationwide screening program for newborns that resulted in significant reduction of mortality in young children with sickle cell disease around the world. Dr. Gaston has dedicated her career to advancing the health of poor and minority families. A renowned ambassador of health, Dr. Gaston is a speaker on such topics as women's health, minority health, improving access to health care, sickle cell disease, and the needs of children and adolescents.
Hi, I'm Aria Nelson. Dr. Rosenpain Epps was the first African-American president of the American Medical Women's Association. She wrote more than 90 professional articles in her career.
I'm Nicholas Holman. Dr. Sharon Henry is the first African-American physician to be elected into membership as a fellow in the American Association for the Surgery of Trauma.
Hi, I'm Lindsay Deswally. In 1992, Dr. Mae Jemison became the first black female astronaut in NASA history and the first black woman in space. She began college at Stanford University to study chemical engineering when she was only 16 years old. Dr. Mae Jemison graduated from Cornell University Medical School and served in the Peace Corps as medical officer.
Hi, I'm Kaylee Young. In 1980, Dr. Alexa Kennedy became the first African-American woman neurosurgeon in the United States. Dr. Kennedy specialized in pediatric neurosurgery and was the chief of neurosurgery at the Children's Hospital in Michigan. Dr. Kennedy was the first African-American and the first woman to specialize in pediatric neurosurgery.
Hi, I'm Tamia. In 1837, Dr. James McCune Smith became the first African-American to earn a medical degree. After being denied admission to many American colleges because of his race, he graduated from the University of Glasgow in Scotland. In New York, Dr. James McCune Smith started his medical practice and also opened the first black-owned pharmacy in the United States.
Hi, my name is Nairi Mansell. Dr. Rebecca Lee Kempler, the first African-American female to earn a medical degree, graduates from New England Female Medical College, Boston.
Greetings, everyone. My name is Teretha Jones. I'm a registered nurse with extensive public health background, and I'm going to give you a little history of vaccines and health disparities in the Black community. This particular Black History event is addressing the history, health, and sanity in the midst of COVID-19, and the events of the past 2 years have exposed what has been going along in the community for many decades. It's highlighted the long-standing health disparities in Black and Brown communities, and it's also amplified the areas where we have major room to make improvement. Before the COVID pandemic, racism was called a public health crisis, and it's put public health principles and issues on the forefront. Let's take a look at the history that many are not aware of today. Hold on to your seatbelts. Hold on to your chairs. You're going to get a crash course in our public health history.
Many of us feel like we have never been here before. The American people, in fact, have. Mass vaccinations and disease outbreak has come to our country with smallpox, the 1918 flu, and polio. And in those times when we ran to science to help us, we were in periods like now of what feels like chaos. Every time our lives en masse were threatened by disease, we have reacted.
It is chaotic every single time because the human element comes into it, right?
Epidemiologist Renee Najera runs the History of Vaccines Project, a look at mass vaccinations of our past.
The first true mass vaccination was the smallpox vaccine efforts. Local cities and governments required it for school, beginning with Boston in the 1850s, and that led to mass vaccination efforts.
Over time, the stockpile of that vaccine was acquired. But in the late 1940s, America's fear of smallpox was put to a big test.
The first really big one that really caught the attention of the world was in New York City in 1947. There was a traveler from Mexico who drove from Mexico City all the way to New York City with smallpox, exposing people along the way. And the city of New York had vaccinated something like 6 million people in about 6 weeks.
6 million vaccinations in 6 weeks in one city.
They did it quite successfully, but it was chaotic. There were lines and lines of people to get the vaccine.
Another test with another disease came just 8 years later, polio. In 1954, Dr. Jonas Salk's vaccine went to what in essence was a nationwide trial, and parents lined up with kids en masse just for a 50-50 chance of getting the vaccine versus the placebo. When the vaccine proved effective in that half that got it, the next year showed demand outpacing supply.
In 1955, you just had throngs of people lining up for hours all over the country to get the Salk vaccine. And so that was millions of people. There was some involvement from the federal government, but it wasn't like coordinating or anything like that. The local health force had a lot to do with it, but it was massive. It was millions and millions of children.
And in that same year, fear would strike in the middle of vaccine distribution when drug maker Crader Laboratories made a huge mistake.
They released 200,000 doses with live polio that was not inactivated, it was not killed, and you ended up with a few thousand children who got polio, and out of those, several dozen who were paralyzed, and that scared people away from that vaccine a little bit. So not only was there a shortage, the mistrust began there.
Mistrust of vaccine didn't come in that moment, though. That came almost 100 years earlier.
The Anti-Vaccination League has been around in the U.S. for a while, since probably the 1850s when the first smallpox vaccine mandates were made.
Which is all just to show, when we look at history, we find things we find ourselves dealing with right now. Folks protesting the wearing of a mask, some people pushing back on a vaccine, and folks who want it, rushing towards it, sometimes in lines as far as one could see, which we see in hindsight and in current sight.
Whenever this happens, we always see this chaos. What do we do? What do we do? Who does what, you know?
America has a history with vaccine development as well, and not a short one, 220 years of it. And that history means as time and new disease marches on, vaccine will be made for those diseases faster and faster. COVID's vaccines came in less than a year. It took 4 years to get the one for mumps in the 19th.
So that was a little tidbit for you. Remember, vaccines have been mandatory in America for decades. There are diseases we no longer see now because of the mandates and because of the vaccine development. And also understand the anti-vaxxer noise is not new in history. COVID-19 has exposed health disparities in the Black community, and you're asking, what are health disparities? It's defined as a health difference that adversely affects disadvantaged populations based on one or more health outcomes. And for the purpose of this particular program, we're talking about health disparities in Black communities. Who are the health disparity populations? That includes racial and ethnic minorities when we talk about public health, less privileged and socioeconomic statuses, meaning rich or poor and middle class or everything in between, underserved rural residents or locations based on where people are and don't have access, and then the other subjects of others that are subject to discrimination. These populations have poorer health outcomes that are often attributed in part to social disadvantages and or being underserved in a full spectrum of health care issues and needs. What are the mechanisms leading to health disparities? We call these mechanisms social determinants of health.
I should really go to the doctor, but the closest office is an hour away. I can't take that much time off work.
Since I got laid off last month, I felt so stressed. I need to provide for my kids, but no one is hiring. I don't know what to do.
I used to know every single person that lived on my block. Now I don't even recognize the place. There's just no sense of community anymore.
When we talk about how to maintain our mental and physical health, we often focus on things like eating healthy and going to the doctor. But our health isn't just affected by the choices we make, it's impacted by our environment. The conditions in which people are born, grow, work, play, learn, and worship are called social determinants of health. Social determinants of health can be visualized as a river with two categories of determinants, upstream factors and downstream factors. Upstream factors occur at the systemic level. Examples include institutional discrimination and accessibility of education, employment, housing, healthy foods, and quality health care. Downstream factors are specific to individuals. Examples include employment status, level of education, and aspects of identity such as gender, race, and disability status. Just as building a dam upstream impacts the flow of a river downstream, upstream social determinants directly affect downstream ones. Consider race. In and of itself, race does not impact health. Rather, systemic racism leads to consequences like less access to employment and education, which in turn negatively impact health. To begin to recognize the relationship between social factors and health, consider these statistics. Suicide rates are highest in the Western American states and in Appalachian regions. Non-Hispanic Black individuals have the shortest life expectancy of any racial group, and the mortality rate of Black infants is more than double that of white infants. And as compared to people with an annual family income of $100,000 or higher, people with a family income of $35,000 or lower are 5.4 times more likely to experience serious psychological distress, but 10.6 times more likely to go without needed care due to cost. Tackling the social determinants of health, especially the upstream factors, can seem like a huge task, but we can all make a difference by advocating for change in our own communities. A good place to start is with the U.S. Healthy People website. This site has stated goals related to social determinants, which are aimed at improving the following. 1. Access to jobs, food, and housing. 2. Access to education. 3. Community connectedness and inclusion. 4. Access to health care and health literacy. And 5. Neighborhood safety and housing quality. Throughout this process, remember that systemic issues impact individuals differently, that people are the experts of their own lives, and that social structures won't change overnight. But with empathy and sustained effort, we can better the health of everyone.
Unfortunately, even as therapy has become more mainstream, the Black community has had a tough time getting the help that they need.
It's hard enough to get mental health treatment in the U.S., but studies show that racial and ethnic minorities are significantly less likely to receive mental health treatment than whites.
Black and Hispanic children are less likely to get mental health care than white kids. And studies show that irritability in the average white teenager is often labeled as depression. That same behavior is more likely to be seen as disruptive in Black or Latino children, and doctors say that can lead to feelings of hopelessness at a very young age.
Yes, one of the reasons many Black people don't get the proper treatment is misdiagnosis. What is seen as depression in white people can be seen as disruptive behavior in Black people. Even when Black people are properly diagnosed with mental health issues, it can still be a challenge to find a therapist who's equipped to handle their needs.
Making the crisis worse, not enough African American therapists. Today, only 4% of psychologists are Black.
Kevin Durden says admitting he needed help was actually easier than finding it. He saw 3 different therapists, but felt that none of them understood the stress and emotions unique to Black men.
When Taraji P. Henson's own son Marcel was struggling, she found it nearly impossible to find him one.
Trying to find a culturally competent therapist was like looking for a purple unicorn with a gold horn.
Do they understand the cultural context from which I'm coming from? Do they understand the culture that I live in?
That's right. It's extremely difficult for Black people to find a Black therapist. And it's been like this for a very, very long time. I mean, now you may think that a therapist's race shouldn't matter at all. And that's true. But if you think about it, it does make sense. For many white therapists, no matter how good they are, it can be hard to understand the particular experiences of a Black person. You know, just sitting there in a session, even if they're trying, it could be like, so you say people are following you around the store and you're invisible, but only to taxi drivers? Paranoid delusions. So when it comes to mental health, there's a very real struggle for Black people to access healthcare, get diagnosed correctly, and find a therapist who can relate to them. But if that wasn't bad enough, there's another major hurdle stopping Black people from getting therapy, and it comes from the Black community itself.
We have a stigma in the Black community when it comes to dealing with mental health.
Black students say where they come from, it's shameful to talk about anxiety, depression, and trauma.
It's not okay to have mental health issues, or like that's a white people thing.
I've heard all the time, Black men don't go to therapy, they go to the barbershop.
I told my own mother that I was seeing a therapist, and she said, you don't need to see a therapist. What you need to do is see a preacher.
You got Jesus.
Right.
You don't need anything else,
Right.
Just buck it up.
Ah, yeah. That's a line every Black person knows all too well. You don't need therapy, you need Jesus. And my response is always, why can't we use both? Because church is a great place for community, but therapy is great for one-on-one mental health needs.
Today I will be speaking with you about stress management. What is stress? Stress is something that we all go through. Sometimes it's good forms of stress, and sometimes it could be really bad forms of stress. But chronic stress is what we should pay attention to because it has long-term effects. Chronic stress may look like cognitive problems, such as your memory, focusing, as well as worrying and anxiety. I like to look at anxiety overall because it does impact our thoughts and our memories at that moment. We have this limbic nerve in our brains, and when emotions are driving our behaviors, it turns off our ability to learn and retrieve information from our long-term memory. But I also want you to focus on this. Negative thoughts is like having a negative committee that is running around your brain and telling you all of these negative thoughts. I call that negative self-talk. What should you do at that moment? I have an exercise that you can use. It's called the stances of me. It's where you use me, myself, and I. Me is the person who is manifesting those thoughts. Me is the person who is telling you those negative thoughts. I use myself to assess me and say, wait a minute, where did that thought come from? And then I use I to affirm or to dispute that claim. And I says, wait a minute, I can do anything I put my mind to. Why am I telling myself I can't? So you turn that negative self-talk into positive self-talk. Then we're going to move over to emotional factors. Emotionally, when we are stressed out, we do not show up as our natural happy selves in spaces. Oftentimes, we can be moody, we can be very irritable, we can be angry, and that's a secondary emotion. Looking at the emotion and understanding where that emotion is stemming from at that moment is what you need to do. So you want to just stop, pause, refocus, and reset yourself. You want to think about that upset moment, right? And take a second for yourself just to find a happy memory. How fun is it that we have a brain that stores memories and we can retrieve those happy memories at any point in our lives? So I encourage you, when you're feeling upset and you're feeling down and you're feeling sad, for 30 seconds, turn it around. Think about something that makes you feel happy.
The thing I appreciate most about KYDS is just the impact they're making on our community. I've been a resident of Neptune my whole life. There are so many people in our community that would never have the opportunity to experience the things that KYDS is putting out there.
Wholeness and love. My name is Rodney Solomon.
Peace and love. My name is Michael Mills.
And we are the co-creators of Conscious Youth Development and Service.
A motto of our organization is to be the change you want to see in the world, and understanding everything starts with the source, myself. And the more I can heal and develop and transform myself, the more the world is going to become a better place.
It's the only summer camp that he was sad to leave last year. So that says a lot about how he felt accepted and received and loved. And it just, I think it opened his heart, just the things that he's learned in the process.
Where we're understanding the importance of self-transformation through techniques of just observing the breath, connecting to the breath, yoga, mindfulness, and these different tools and techniques where we saw that transformation, understanding that the true change starts within ourselves. And through that observation, we had an obligation.
And in that obligation, we realized that this journey, if we just traveled it alone, would not be as fruitful if we could share this knowledge with those around us. And we began to think and brainstorm about how can we share this light with those that we're closest to. So we decided to make this a part of our life, beginning to integrate these mind-body practices, these holistic tools, and sharing with those folks closest to us. And that looked like, for us, it all began as recognizing how we had to bring this out into a space where the community can accept us.
I am powerful.
I am love.
I am love.
I am light.
I am light.
One important lesson I've learned this summer is just to be me, and yeah.
My goal is to basically be community oriented, work with the kids to try to basically stem the violence and the degradation in the kid in the community, and just try to help them. We try to put entrepreneurial courses. I try to teach them. Other than boxing, I try to coach them on being entrepreneurs. Try to, have mat chat, talk about their home environments. I got a lot of kids that are fatherless, so I talk to them, become their uncle more or less. They call me Uncle Ash or whatever. But Southpaw is what I was told was the gym that heals. I was surprised when a person said that to me, but it made me feel real good that they felt that way about this gym. Because I've been doing this, like I said, since '89. And I started, once I came from the military, after training a lot, I said I'm going to open up something in the community and give back to the community that I felt gave to me as a youth. So that's basically my mindset. And I started out with ICAT Academy, which is International Compatible Arts and Technologies, from my wife, who I married in 2007, said that name is too long and nobody understands what it means, so it need to be simple. So I said, okay, I'm a Southpaw. So I just called it Southpaw. So that's basically what we changed the name and went on from there.
Good afternoon. My name is Terry Ivory, and I am the current president of the Concerned Black Nurses of Central New Jersey. The Concerned Black Nurses of Central New Jersey is a driving force that embraces and facilitates innovative health practices while providing education in underserved communities like ours. Our contact information is P.O. Box 841, Neptune, New Jersey 07753. Our group was incorporated in 1987, which is a non-profit organization under the umbrella of the National Black Nurses Association. Thank you once again for this honor, and we look forward to serving you.
My name is Kevin McMillan from the Neptune Township Black History Month Committee, and I'm here to announce the essay winners of our scholarship program. But first of all, I'd like to thank the sponsors of this event, Mr. Timothy Harris, along with the brothers of the Iota Chi Sigma chapter of Phi Beta Sigma Fraternity Incorporated. Now moving on to our contest winners. In the elementary school division, the first place prize goes to Jenna Liddick. The second place prize goes to Elise Ruiz. The third place prize goes to Braylon Perez. In the middle school division, the first place prize goes to Destiny Zapata. The second place prize goes to Whitley Lauder Joseph. In the poetry section, the first place prize goes to Rosemary Cole. The second place prize goes to Abigail Pychek. And in the PowerPoint category / poster, the first place prize goes to Abigail Alonso. The second place prize goes to Shakaya Glisson. And in the video division, the first place prize goes to Nathan Richards. Moving on to the high school winners, the first place prize goes to Miss Sanaya Hughes. The second place prize goes to Natalia Bray. And the third place prize goes to Sky Breckner. We thank you all for your participation in this program and look forward to the participation next year. Thank you.
I hear about a new variant from social media.
I heard that it kills people. Like, many people think it's not true, and it's just like the flu, but really it's really dangerous.
I think it's good. I'm vaccinated, so.
I've heard a lot of myths. Well, I don't really agree with it. I wouldn't get it. I mean, I personally don't have it. I think it's free will, so whatever you want, you can do. I've heard that the new variant of COVID is highly transferable in comparison to the other ones.
I think that everybody should get the vaccines. I think the vaccine could really just help out, slow the spread, and make everyone a lot safer.
But I think we should take everything on social media with a grain of salt because it's not always true.
Yeah, a lot of people think that since the cases in Corona keep fluctuating, that the vaccine doesn't work, and that people who get vaccinated can still have a high chance of getting COVID.
I heard that it could make people not have the ability to have kids, but really that's not true. There's been no links that connected any of them.
I've heard a lot about different COVID variants are coming up, like the Delta and Omicron, things like that.
I've heard that there are new variants around that are spreading fast.
I've heard the vaccine gives you infertility.
I think they're helpful, and I think it's a good way of trying to stop COVID from spreading because vaccinated people are less likely to get it and then in turn less likely to spread it.
I am fully vaccinated, so 100% I like the vaccine.
Well, thank God none of my family members have been affected by it. We have been doing the protocol to keep yourself safe. Definitely believe in the vaccines. I don't understand why in this space age era, why so many people are against it. But no, it definitely has affected everybody, whether it touched you personally or not. It affects where you can go and what you can do. I'm glad they have it. Wish more people that are otherwise intelligent don't take advantage of it. I don't understand it. You know, when we hear about our first pandemic, 1917, what's wild is they still refuse to admit that it was even here. And thank God it went away by itself because they didn't even have vaccines.
Oh, yes. It's hurt us socially so much because we can't gather the way we used to. We have certain family members, they say, well, if one particular family member is not vaccinated, I'm not coming, and all this sort of thing. So the holidays have been very different this last couple of years. Thanksgiving, Christmas, the whole 9 yards, very, very, very different. And, we had to make a lot of adjustments. I think it's a wonderful thing. I just feel that it's a lifesaver, and I think that all of us should get vaccinated. I just wish all people would do that. I wish they would take the politics out of it and put their right arm or left arm up there and say, okay, stick me.
I've had a couple of good friends, husband and wife, that passed from COVID within a week of each other.
Okay.
My nephew in North Carolina has COVID. My nephew in North Jersey had COVID. He was quite ill when COVID first, started affecting us, but thank God, he survived. And I've had several friends that have been diagnosed with COVID. I think vaccines are necessary, just the same as we get the flu vaccine to help us get through any flu or flu pandemic. The vaccines for COVID were researched and developed in a rapid manner, but that's because we're in an age where it doesn't take 20 years to research and develop any medication.
Right.
So it's a positive thing that we were able to get this vaccine as quick as we did. Seniors aren't able to get out and communicate as they were in the past. Another is that seniors are fearful of the vaccine being developed so fast. They are, or I should say some of us are locked into the slowness and the longevity of the government developing or science developing certain things. So bringing seniors aboard has been difficult. Mentally, they are depressed because of the isolation. And it takes a toll on the seniors because some are alone, children the extended family is no longer current as it used to be. And so family members, children are far away from their parents and they can't get to them. The nursing homes where visitors could not come in to see their family, their loved ones, has been difficult. So it puts that person into a depression. It really does play a big part in recovery, having your loved ones available. A friend of mine, Carolyn Singleton, and I formed a small group where we provided local nursing homes with iPads that the patients could communicate with their families. And hopefully it did help some. Well, one that I think is very impactful are senior citizen centers, where the seniors can go out, they can have conversation with their peers, they can have games, they play games, they take trips. So it's a community that I think is very impactful. And from that, there are many healthcare organizations and other organizations that they can tap into. They are provided this information.
Prior to COVID, I was able to meet in person with my friends, family, and other colleagues. And since then, it's more of self-isolation almost. So in that respect, it has affected me because I was used to going out, being my worship services, my community projects, and things like that. So it has affected me quite a bit. But I'm dealing with it. That's the main thing.
And you look good while you're dealing.
Oh, bless you.
What thoughts do you have about vaccines?
I definitely believe in vaccines. I've been vaccinated, I've gotten my booster, all of my family members have gone there. So I encourage anyone and everyone to get the vaccine because that's the only way we're going to conquer this horrible situation that we're in. Well, some of the physical ones are being able to navigate once you get a certain age, you get a little stiff and then you have to depend on someone to take you places if you don't drive. Mentally, it's isolation if you live alone and you don't have family members or friends to support you. So those are some of the things that I know have affected some of my senior friends. One of the things that I've been involved in a local senior citizens. They've been very helpful to me and some of my friends because even though in the beginning they were closed, not having people come in, but you can go there to get meals, you can go to socialize with other people. They have exercise programs. I was in ceramics for over 20 years there, so it does give you the opportunity to get out and socialize with other people in your area.
Well, we're separated. We're separated from each other too much. We don't. At first, I have a great-granddaughter, 5-year-old, and I miss not seeing her. Well, I think I've lived long enough to see so many diseases eradicated. I was in my 50s, I believe, when I took the SALT test. When I get aggravated, I get high blood pressure. Well, they have the senior citizen building, in Asbury, which I've gone through. I go once in a while. I don't go every day. Okay. But they go down to the Columbus Market. I always make sure I go there. But it's a lot of mingling. I prefer not to do it.
You are not hidden. There's never been a moment you were forgotten. You are not hopeless. Though you have been broken, your innocence stolen, I hear you whisper underneath your breath. I hear your SOS, your SOS. I will send out an army to find you in the middle of the darkest night. It's true, I will rescue you. There is no distance that cannot be covered over and over. you're not defenseless. I'll be your shelter, I'll be your armor. I hear you whisper underneath your breath. I hear your SOS, your SOS. I will send out an army to find you in the middle of the darkest night. It's true. I will rescue you. I will never stop marching to reach you in the middle of the hardest fight. It's true. I will rescue you. I hear the whisper underneath your breath. I hear you whisper you have nothing left. I will send out an army to find you in the middle of the darkest night. It's true. I will rescue you. I will never stop marching to reach you in the middle of the hardest fight. It's true. I will rescue you. Oh, I will rescue you.
There are many different things in our lives that contribute to being healthy, or being healthier. In this video, I'm going to go over 7 major factors that contribute to leading a healthier life. Number 1, eat better. So I think this one's kind of a given. We have all at some point seen some reference to research that links poor nutrition to many diseases, a lesser quality of life, and a shorter lifespan. Good quality foods such as fruits and vegetables provide our bodies with energy, vitamins, minerals, and fiber, which in turn enhance proper bodily function. Number 2, exercise. Research has shown that exercise can decrease your risk of many diseases and enhance your quality of life. It can also improve your mental health, strengthen muscles and bones, help to control your weight, prevent falls, get better sleep, improve memory, give you more energy, and most importantly, increase your chances of living longer. Number 3, move more. Just moving your body can improve your health. With the advancements in technology, sedentary lifestyles have gotten greater and greater. Phones, tablets, and being able to watch TV anywhere, anytime, has brought everyday bodily movement to an all-time low. Moving your body more can improve circulation, oxygen use, heart health, and sleep. Number 4, sleep better. Lack of sleep has been linked to an increased risk of many diseases as well as lack of productivity. Good quality sleep has been shown to improve memory, decrease stress, increase creativity, and increase athletic performance. Number 5, spend time with people. Lack of social connections has been shown to increase stress, impair immune system function, and cardiovascular function. Having strong quality connections with other people improves self-confidence, mental health, and energy levels. Number 6, exercise your brain. When we're young, going to school and learning math, science, and history, our brain is being challenged and stimulated regularly. As we get older and get set into a regular routine and exercise our brains less and less, we process information more slowly and our working memory diminishes. Your brain benefits from learning new things, taking part in new activities, and interacting with other people. Your brain, like muscles and joints, needs to be exercised. Number 7, decrease stress. Stress can cause fatigue, lead to sleep problems, overeating, alcohol abuse, and depression, all of which can negatively affect your health. Learning to manage stress in your life is a must. Reducing stress in your life can improve energy levels, improve your ability to focus on tasks, improve your relationships with others, and most of all, severely increase happiness. Living a healthier life leads to living a happier life. Self-reflection is a powerful tool to improving your life. So take a look at each of these 7 factors and see which ones you can improve on. In the future, I'll be posting videos giving you some ideas on how to improve on each of these to help you out.
What's that sound?
I like to move it, move it. I like to move it, move it. I like to move it, move it. You like to move it. I like to move it, move it. I like to move it, move it. I like to move it, move it. You like to move it. I like to move it, move it. I like to move it, move it. I like to move it, move it. You like to move it. I like to move it, move it. I like to move it, move it. I like to move it, move it. You like to move it. All girls all over the world. Original man, stop man, pon your case, man. I love how all girls are move them body. And when you move your body, you move it nice and sweet and sexy. Alright? Woman, you're cute. How you doing? Original cute body.
I got 1, 2, 3. 70. 1, 2, 3. 40. 40. 0. 0. 0, guys. 0. 0. 0. No!
Let's get it. Do you feel like moving? Moving. Do you feel like moving? Moving. Do you feel like moving? Moving. Everybody put your hands in the air. Do you feel like moving? Do you feel like moving? Do you feel like moving? Come on, come on. Let's get it. Do you feel like moving? Moving. Do you feel like moving? Moving. Do you feel like moving? Moving.
Take
Neptune community. Hope you are enjoying the Black History Month celebration. My name is Maud. I'm Desiree. I'm Libby. I'm Giselle. I'm Isaac. And we are the Neptune Varsity Cheerleaders. Hope you're ready to get fit with the Flyers. Today we will be doing our 2-minute warm-up. Each exercise is 25 seconds, starting with the jumping jack, clap at the top, cross jacks, hit a T, front jacks, and cherry pickers. Ready, begin. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25. Hope you enjoyed getting fit with the Flyers.
Tryna rain on the thunder. Tell the storm I'm new. I'ma walk, I'ma march on the regular. Painted white, flags blue. Lord, forgive me, I've been running blind in truth. I'ma rain on this bitter love. Tell the sweet I'm new. I'm telling these tears going fall away, oh, may the last one burn into flames. Freedom, freedom, I can't move, freedom, cut me loose, yeah. Freedom, freedom, where are you? 'Cause I need freedom too. I break chains all by myself, will let my freedom ride in hell. Hey, I'ma keep Lift every voice and sing till earth and heaven ring, ring with the harmonies of liberty. Let our rejoicing rise high as the listening skies. Let it resound loud as the rolling sea. Sing a song full of the faith that the dark past has taught us. Sing